Welcome to the Doctor Connect Show, the home for open conversations where top experts share their experiences and empower you with transformative education around cancer, health, wellness, and medical technology. I'm your host, Dr. Ludmila Schaefer, and I'm so excited to be bringing my years of experience as a medical oncologist to the podcast and television world. I have conducted a number of interviews and found out that many people share that they have given up on the American dream because the road to success is too dumpy. Life is unpredictable and challenging, especially in the past few years. And defeat and fear keeps people from fulfilling their roles they know they will help themselves, but most importantly, make a difference in the lives of others. Have you ever thought of sharing your story to help others? Maybe there is the other side of your occupation or experience that people don't know, but would find out very useful once they hear your story. Thank you to all of you who connected with me throughout my book, The Other Side of Oncology: High-Octane Observations from the Medical Front. The Other Side of Oncology documents the victories, courage, and bravery taking place every day in our clinics and hospitals, even in the midst of tremendous hardship, and helps us connect the dots, making the path easier to navigate for all patients and caregivers. When my book, The Other Side of Oncology, was released, I could never have imagined that it would become #1 bestseller in 8 categories, including healthcare delivery, oncology, medical administration and policy, physician and patient, and chemotherapy. Writing a book is a process. Just like everything else we do, it requires time, effort, and work. Many people feel guilty when they take a vacation because it puts pressure on organization, clients, colleagues. But we know taking a holiday is so beneficial for both mind and body. And if you are one of the 30 people that don't feel guilty take vacation, you still come back to a lot of work being on hold. Just admit it to yourself. I used to feel guilty too, until I discovered that there was a way to take a vacation and not feel guilty. The answer is a vacation in combination with business. I created a retreat in Cyprus. It's affordable and very empowering. The time you spend in Cyprus is to advance your company, your business, create media content for your organization, your business, learn how to leverage your expertise in combination with time to relax and unwind, banish the stress of a hectic daily life and a high-pressure job. You spend time on stunning beaches, many of which rank among the best in Europe. You will have the most delicious food. You'll go to the world spa. You will learn real estate options and bring home valuable content to grow your organization, clients, and your business. Imagine warming yourself in the sunshine, then brighten your mood and gives your business opportunities. Cyprus is the perfect paradise that will exceed your expectations and make your holiday dreams come true with advancing your business. Cyprus is suitable for business people who prefer to know the measure of entertainment and recreation. And if you are looking for a better health, global partnership, and want to make a social impact, you've come to the right place. From sacrifice to a celebration and the answers on how to turn your life around. You can also find our interviews on the podcast. So listen, watch, give a rating, and subscribe so you never miss an episode. And if you like our show, subscribe and comment. what you like about the show, go to the website, thedoctorconnect.org, and click the button, submit the question. You can either submit your question, or if you want to share your medical journey or health, wellness story, simply type, I want to share, and we will reach out to you. And if you are in healthcare and want to make a legacy through your expertise or passion, you can schedule a free consultation call on National Impact Strategy. Whether you are a clinician, researcher, entrepreneur, mentor, working in the industry or leadership, maybe coaching, you will gain tools how to spread awareness of your expertise. Many people move from the comfort home to study or to work to sacrifice their lives for the service of others. So they will be more educated and experienced to bring the best to the community. And I'm so thrilled because I'm joined today by a very special guest, Dr. Diana Larrea, an award-winning physician in humanism, an educator, and a Spanish-speaking doctor who moved away from home, dedicated over a decade to medicine. She knows firsthand the complexity of a new commitment to have a healthy life. She is a family medicine physician and has a mobile clinic that helps patients through communication directly with primary care physician. Visit them at home on the personal time and creates the best healthcare team for patients so they feel comfortable and have the best health for themselves and their families, and spend time doing what brings people joy. Let's welcome Dr. Diana Larrea. Welcome, Dr. Larrea. I'm so excited to have a conversation with you today. And before we start, can you tell us about yourself?
Thank you so much for having me, Dr. Schaefer. I'm really happy to be here. So my name is Diana Larrea. I'm an osteopathic physician, family medicine trained, and I'm also a Latina physician. I speak Spanish fluently. My parents are from Ecuador. I'm also a mom of Irish twins, and I started with my husband. So in my 10 years of experience as a physician, I've seen that Latino communities have had a hard time accessing their physician, and whether it is relating to language barriers or where they are at in their medical health journey, it has been difficult, for a lot of the Latino patients to get in touch with a physician.
And it is a very huge problem because it's a huge communities, and it's a barrier when you're sort of belong to a certain community, and when you feel like it's only few or not very many of you. So having day-to-day life is very difficult, and especially in a situation when someone gets ill or sick and having problem. So what exactly are you providing? What exactly you're doing for the Latina community?
So we have created ways to basically provide the care that they need at their own home, at their own time. I know most of us in the community are very, very busy, either whether we're parents or not. We have a lot on our plate, and we try to make it easier so that the medical concerns are addressed appropriately and in a timely fashion. So, for example, if someone is sick at home and is too ill to get out of the house, we make it easy and comfortable for them so that we go to their house and they don't have to wait for anyone, at a doctor's office or anything like that, and expose themselves unnecessarily to other illnesses as well.
That's very valuable. And I've learned that you design a special movement. It's called Meeting Where You Are. Is that correct?
Yes. So
can you tell us about this? Mm-hmm.
Sure. Thank you so much, Dr. Schaefer. So I did create that movement because I noticed that, especially with the pandemic, there's a lot of need for the doctor to come to you, similar to the olden days where the doctor would take the medical bag and examine the patient at their home, at their bedside. We made it a point to meet the patient where they are physically, but also holistically. So in the sense that sometimes patients could be, not mentally prepared to, or maybe even anxious to see their physician at the doctor's office. So we've made it more convenient for the patient and more comfortable for the patient because we go to their home and meet them where they are.
So all across the nation and many times across the world, what would you recommend to other, physicians, healthcare providers, as well as, patients, how we can communicate so then we can help not only in a particular state you are, but also all across the nation?
So we've created a direct way to get in touch with the physician. So it's, in this case, it's my husband and I in New Jersey who created a platform so that the patients and their families alike can communicate with us directly without having someone in the middle trying to communicate with us. And we've also made sure that we have not only, video access or phone call, but also email and text messaging 24/7.
So communicate directly with your doctor. And I know that I've had a conversation with other patients, and a lot of patients and families say, well, we dial the number and we are on hold, and then we have to transfer this and we have to transfer, and it's just a long haul. So how do you make that it's actually accessible?
So I found it very, very helpful to give patients our office number that literally their messages or phone calls will be able to come to that platform. It's a HIPAA secure patient portal that basically we communicate through there. And we also communicate with our team internally, so that way we're able to ensure that the patient gets the complete care and quality care that they deserve.
And if somewhere, let's say in a country, and we give, phone number, let's say, my institution to the patients, and it's very difficult to reach, do you have any suggestions? So maybe, tools, what can we do better to help patients in terms of that, phone number? Sometimes it's very difficult. It's great that in your situation, you have a specific phone number, it's you and your husband, and you're such a strong team. But how can we extrapolate this at a larger scale from your perspective?
So it would help to have someone that is, equipped at the front line to answer the phone, to first triage the patient and make sure that, the level of risk, of the condition that they're undergoing, that could essentially understand how severe it is. And if it's not severe, then they could definitely directly communicate with the physician through the portal. But at the end of the day, I definitely think there needs to be a direct access to the physician. It's just a matter of making sure that the physician has the time to get to those messages. So I see that as a big issue with a lot of colleagues as well, that work in the system, where it could be difficult for them to, go through their inbox messages and get back to the patients in a timely fashion.
So how do we address this barrier? Because yes, sometimes physicians, they see patients every 15 minutes and clinics overwhelmed. How can we redistribute?
So I definitely think that it would help to have a care team. So we create care plans, and we create basically a team of specialists and nurses and staff and anyone, like medical assistants, for example, that would be able to help communicate, but also understand the problems that the patients are undergoing, so that we can go directly, to the problem and figure out and solve the problem together as a team. I definitely think we need more teamwork and collaboration.
And when more than one person taking care, and then patients kind of learn, okay, so this is the person to go. Let's say a physician or a nurse or medical assistant, or maybe sometimes patient navigator. And in this situation, how we can distribute time. It's for patients, it's also very difficult. They have to work and maybe take care of the family members, and especially when they are sick. So how do we address that specific time to be in the right time for the patients?
So if our time were to overlap, there's something called shift work that we can hone into a little bit more. And if we are on call, let's say, and it's a big team, we can definitely ease the burden on just about everyone, because we're able to work as a team in a timely fashion. Meaning that if I'm, on call for, let's say, 8 hours, and then someone else takes that, shift, we would basically, work together to make sure that the team covers the patients at the time that they mostly need it. So that way, if there's an issue, it doesn't have to wait more than 24 hours. And if it's an emergency, then definitely someone will be there on the team waiting for the patient to reach us.
Can you walk us through maybe general, average kind of schedule? A lot of our audience would be listening, and, we don't always know, just like in the other specialty, I don't always know what is it shift, what is it a call schedule. All I care when I am sick, I just want to see the doctor. Can you tell us, maybe walk through average schedule, let's say for a physician or team, so kind of for us to understand what's call, what's shift, so we have a little bit of an idea.
Sure. So there are, the care team could consist of, obviously the physician, the mid-level practitioner, the medical assistant, the nurse, etc. But, and of course the receptionist, etc. But the main thing is that if there's, let's say, a 12-hour time frame where that provider or that team member is working, they are in charge of honing in on what's going on with the patient, and then they're able to communicate, which is the most important part, to communicate efficiently and effectively with the provider directly. So the provider, being me, for example, I would then take the call, and call the patient myself and figure out what's going on. And then if the next provider, let's say 12 hours after that, the next provider is able to then pretty much receive my message and then take care of the next problem, right? So it's really more of communication that we want to establish.
Can you tell us about like the average day? We start, let's say, 6, 7, 8 in the morning, and then what happened? What is the kind of average routine?
So Dr. Schaefer, I believe it's more of where you are. So the setting definitely changes when you are in the ER, because urgent care and ER is very different from primary care. They are open, 24/7 essentially. And in our direct primary care practice, for example, we are just my husband and I, so we have the ability to pretty much communicate just between us. So it can be a little bit easier to have just two providers, but at the end of the day, it's really comes down to, how you communicate and what platform you're using. So for example, if you are able to send a voice message to the provider that is also working with you, it'll probably be easier to, listen in on the message, as opposed to having to type or email, right? So now we have so much technology that could help us communicate more efficiently, and I think we need to utilize those to the best of our abilities.
For your community, what is the message you would give right now to the patients that actually listening to you?
So my message would be that I am excited to help you in any way. I want to get to know what the community really, really needs. So I know that there's so many diverse backgrounds and needs in the community. So the number one thing is to get to the doctor. So if it's myself, for example, you would be able to communicate in Spanish with me if you speak Spanish, or if, or if you're homebound and maybe you don't even have insurance and you need to figure out a way to get to a doctor, and if it's something that could potentially need a house visit, we would be able to establish a house visit and schedule it for you right away, hopefully within the next, either same day or within the next few days, so that way you don't delay care. So I definitely believe that it's important to get that access and figure out, what do I need as a patient? What are my concerns? And to not delay care.
That's excellent. And I understand that also meeting at patient's own time. Is that correct?
Right. So let's say you have a full plate. You're working 12 hours yourself. Maybe you even work the night shift. So bright and early, since we are available 24/7, you would be able to reach us if texting is more feasible to you because you are at work and something is happening. Communication through the easiest platform that you have is the best way to get a hold of us, as long as you do, communicate it. But the best thing about the practice is that we get to schedule patients based on their time. So, for example, if they're working late at night and their best time is like 7 a.m, we'll make it happen.
And I want to circle back, Dr. Larrea, just for a second. You mentioned about communication, and a lot of times, if it's a different language, it's very difficult to communicate. So how do we bridge this language gap?
We bridge the language gap by, number one, figuring out, thankfully I speak Spanish, but I'm sure there are other languages that need to be communicated. But we figure out before, knowing that there is always going to be some level of barrier, removing the language barrier also helps with the cultural barrier sometimes, understanding the Latino community and sometimes, what their obstacles may be coming from an Ecuadorian background. I myself know that, when my grandma, who was in her 90s, used to go to the doctor and she needed me to be there and interpret whatever the doctor was saying, I was happy to be there and just help her out. Even if I wasn't in the medical field, I know that I would just being there would really help bridge that gap in and the fear. Sometimes we have that fear or anxiety when we go to the doctor.
What would you tell to patients, to the community? Do you have maybe 3 major tips that you would like to share?
Yes. So the most important tip is to listen to your body, number one, because that brings us to number 2. Once you listen to your body, you're able to understand it and figure out if something is actually possibly wrong, and you are able to express potentially, what's happening. So in order to listen to your body, you need to first be in sync with your body, mind, body, and spirit day by day, and really check in with yourself and reflect on how you're feeling emotionally and mentally as well, because that is a very big part of health. The mental health aspects, which we encourage and recommend to, hone in on and make sure that you speak with your doctor about that as well, because a lot of times the mental stressors that we have can definitely play a role in the physical health as well. And number 3, making sure that communication is open and that you communicate any fears that you see, whether it's a language gap, that we have to overcome. We will do it together, and we are working as a team. So I just want to communicate that, we have to eliminate as much fear as we can and as much anxiety we can when we have that comfort with our doctor. So finding out who that personal physician is for you and your family is probably one of the best things you could do for your life and your journey.
Thank you for all this information. And how the audience, how actually patients can reach out and connect with you?
I appreciate being here. I definitely am on, besides our office number, which you can text or call directly, we do have an email. Our number, is 732-314-7410. You can call or text anytime with any questions or concerns. Whether you have insurance or not, we'll figure out a way to help you out. And I am on Facebook as well. And we are online. We are on Google. We have a website. The practice's name is Mobile Medicine NJ, so NJ for New Jersey. And mobile medicine, it just flows. It makes it easier for patients to realize that we are, moving around to see patients at their homes, and that is the name. And then we also have house call doctors. The doctors part is DO in capital letters, because we are osteopathic physicians. And the house call doctor's practice is actually more for the Medicare-based patients that are usually homebound. So there's two different practices that we have. The mobile medicine NJ is for patients that are not Medicare.
That's wonderful, excellent for bringing this step by step and explain. Is anything else you would like to add that from the bottom of your heart for us?
So my heart really, as a Latina physician, I definitely, want to make sure that, care is not delayed, and especially quality care. And the fact that, there is hope for things that you may be feeling in your body that could be diagnosed appropriately and in a timely fashion. So I definitely think that, the most important thing that I want to communicate is that we are here for you, and that we want to make sure that you listen to your body, and that you become, a part of your health, your decision-making health journey, that we have to basically team up and make sure that you make the best decisions for your health, so that way you can live a long, healthy life and have the ability to spend time with your loved ones and not worry about your health, because you know that your health is in good hands, essentially.
Thank you. This has so been delighted, and thank you for all valuable information that you provided, and thank you for being and joining me today.
Thank you so much, Dr. Schaefer. I appreciate your time and all of your valuable knowledge and guidance.
Thank you for being with us on the Doctor Connect show. Do you have a question, an idea for a topic, or would you like to share your experience or expertise? Go to the website, thedoctorconnect.org. Click the button, submit the question. You can either submit the question, or if you would like to share your personal medical journey or health wellness story, simply type, "I want to share," and we will reach out to you. And don't forget to follow up us on social media and join and subscribe YouTube channel, The Doctor Connect. We are super excited to have you on this journey with us. Thank you for watching and listening, and we are looking forward to seeing you in the next one.